All right, we're going to talk about an infection that affects millions and millions of people, but honestly, most have probably never even heard of it. It's called Trichomoniasis, and its most dangerous trick? Its ability to spread without making a single sound.
So, quick question for you. If you had to name one of the most common STIs on the planet, what would come to mind? Well, the answer might actually surprise you. It's trichomoniasis. But the real mystery isn't just what it is, it's how it's gotten to be so common.
And that's the big question, right? How can an infection be this widespread and yet so often completely silent? Especially in men. That's the puzzle we're going to piece together today, because the answer is the key to its success as a silent spreader.
Okay, let's dive in and meet the microscopic troublemaker at the center of this whole story.
So the culprit is this tiny parasite called Trichomonas vaginalis. Now this isn't a bacterium or a virus, it's something different, a single-celled protozoan. You can just think of it as a microscopic organism that likes to set up camp in the vagina or the urinary tract.
Now, check this out. This is where things get really interesting. About 5% of women worldwide have trichomoniasis, but for men, it's less than 1%. And this huge gap isn't just a random fluke. It's a direct clue that tells us exactly how this infection operates differently in different bodies. And we're about to see why.
And that difference in numbers, it leads us straight to the heart of the issue, the symptoms, or maybe more accurately, the lack of symptoms. Because with trichomoniasis, your experience can be wildly different, and it pretty much all comes down to your gender.
I mean, just look at this contrast. For women, the signs can be pretty obvious and definitely uncomfortable. We're talking a very specific kind of discharge, irritation, soreness, pain, you get the picture. But now look over at the column for men. What's the number one symptom? Usually, nothing. Zip. Nada. Some guys might get a little discharge or some mild pain, but for the most part, they feel totally fine.
And this quote from the MSD manual just says it all, doesn't it? This is the entire playbook for the silent spreader. Someone can be carrying the infection, feel completely healthy, and have absolutely no idea they're passing it on.
So, if the symptoms can be so unreliable, or even just not there at all, how in the world do doctors figure out if someone has it? Well, that brings us to the actual detective work.
The good news is, the process is actually super straightforward. It all starts with just talking to your doctor and having an exam. After that, they take a simple sample, usually some discharge or urine. And then that sample gets sent off to the lab for a closer look. And at the lab, they use this incredibly powerful tool called a NAAT. It stands for nucleic acid amplification test. Basically, think of it like a high-tech detective that isn't looking for the parasite itself, but for its unique genetic fingerprint. It's extremely sensitive, which makes it fantastic at getting a definite yes or no.
And it's pretty standard practice for doctors to test for other STIs like gonorrhea or chlamydia at the same time. It just makes sense. Sometimes symptoms can overlap, and it's the best way to make sure everything gets caught and treated all at once.
All right, now for the really good news. Once trichomoniasis is diagnosed, it is totally curable. But, and this is a huge but, the treatment plan isn't just about one person.
The cure itself couldn't be simpler, and it works really well. It's usually just a single course of an antibiotic. You'll see names like metronidazole or tinidal. Often, just one dose is all it takes to completely knock out the infection.
But here it is. This is the single most important part of the whole process. For the cure to actually stick, all of a person's recent sex partners have to get treated at the exact same time. If they don't, you just get stuck in this awful loop of getting cured and then immediately getting reinfected by a partner who didn't know they had it. It's like passing a basketball back and forth.
Now, to make this whole thing way easier, a lot of places use a really smart system called expedited partner therapy. This basically lets a doctor give a patient a prescription for their partner too. That way the partner can get the medicine without having to make a whole separate appointment. It's just a common sense way to break that chain of reinfection fast.
So the treatment is great, but what's even better than a cure? Not getting infected in the first place, right? So let's wrap up by talking about prevention, because that's always your best defense.
Your best defense is really a layered one. Things like using condoms consistently, that's absolutely key. Having open conversations with your partners is also a huge part of it. And, of course, seeking out a diagnosis right away if you even suspect something is wrong. All these steps work together to create a really powerful shield.
So, when you boil it all down, what's the real takeaway here? It's that when it comes to our health, knowing the facts is only half the battle. The other half, well, it's about talking. So we'll just leave you with this one thought. Prevention is a conversation. Have you had it?